Okay, so once again, my name is Dr. Amber Adams. I'm one of the nurse educators here at bootcamp.com, and today we're going to be talking all about prioritization questions. Before I forget, I want to go ahead and introduce another wonderful nurse educator that we have here with us today, Miss Miriam. She will be in the chat answering any of your questions. And once again, the chat is a little bit delayed, so if it takes us a second to answer your questions, we're not ignoring you, I promise. It just takes a little bit for it all to pop up for us to see. Okay, so without further ado, today we're going to talk all about the general principles of prioritization. We're going to talk about why this topic is important and how to approach it from a strategic standpoint. And before we do that, I want to remind everybody that we do have an NCLEX Bootcamp study group on Facebook. And you can see right here, we have this, in this red square, we have an invite link. So please join us there so you can access a ton of really great resources to help you prep for NCLEX. And also, please share that link with anybody else that you know that is getting ready to take NCLEX. Or I know some of you today maybe aren't taking NCLEX yet, and you're just in nursing school and you're going through your curriculum. So please share these resources with your peers. I know they will help you a lot, whether you are in nursing school or whether you're prepping for NCLEX. Now, before I jump into all the great information on prioritization, I wanted to remind everybody that we have been working really hard here at bootcamp.com on developing some cheat sheets for you guys. As you probably know, if you've attended previous webinars that we've put on, we are all registered nurses here on this team with many years of experience in all kinds of nursing areas: ER, ICU, pediatrics, maternity, psych, and we have worked really hard to try to consolidate the most important information that you need to know to be successful on NCLEX, and we have developed these wonderful cheat sheets. We do have one on prioritization that will really help you as you sit down and practice prioritization questions. So this is a little screenshot of it here, and we are actually going to be using this pyramid that you see on the cheat sheet throughout our practice today whenever we are navigating prioritization questions. Okay, so a little bit about prioritization and why it's so important that we understand it and that we talk about it today is that I guarantee you will see NCLEX questions on prioritization. It is a guarantee. So when we look at the NCLEX test plan that the NCSBN puts out, we can see that management of care topics, which includes prioritization and delegation and assignment making, account for almost 20% of the exam, which is a large portion of that exam. So you are guaranteed to see these types of items: prioritization and delegation and assignment making, which we will have a webinar on in 2 weeks if you are struggling at all with delegation. So prioritization basically is just a really great method that the NCLEX uses to assess your critical thinking. I know we say it every week, but NCLEX really is a safety exam. And they want to make sure that you as the nurse can really critically think and be able to make good, safe decisions for your clients. And one of the best ways to do that is to determine, do you know how to effectively prioritize? Do you know which client to see first? Do you know which task to perform first or which lab to draw first? This is all a great method of assessing your critical thinking. And one of the reasons that prioritization questions seem to be so challenging is it requires you to really look at the overall clinical picture of a client. And when you're a nursing student or you're a new graduate nurse, even though you are very smart and you have lots of knowledge, many times you don't have that lived experience of knowing what a patient's condition is going to look like over the course of hours and days. So you just don't typically have a lot of experience there. So sometimes it's hard to picture what's going to happen if I don't see this patient right now. What's going to happen if I don't do this task right now? And that's why these items can be especially challenging. But once again, today we're going to try to make it a little simpler by approaching these prioritization items from a really strategic standpoint. Another reason prioritization questions can be pretty challenging is, as you probably know if you've done many, they never typically involve just one disease process or one type of task or one type of position. Instead, the options are typically asking you to look at 4 different disease processes or understand 4 different types of labs, so they can be pretty complex, and you have to have a pretty good knowledge base to be able to navigate them. Now, another thing I want to note about prioritization questions is they are formatted in many different ways. And so today I wanted to make sure you guys had the most well-rounded experience and have a pretty general good idea of how you might see prioritization questions asked. So I went ahead and we're going to do 3 different styles of prioritization questions to give you an idea of the different way these questions might be asked. And then lastly, I always just love to remind everybody that, of course, we want you to do wonderful on NCLEX and be able to answer prioritization questions well. But also remember, prioritization is a primary nursing skill. So the more you practice this and the better you get at it, it's just going to make you a better, more safe nurse for you and your client. Because every day as nurses, that's all we're doing is prioritizing. You know, we have 5 different patients to see, 20 different tasks to perform. And so the more experience and comfort we can get with prioritization, the better nurse we're going to be overall. So before we jump into those questions, which I know is what you guys came for today, I want to really briefly go over this prioritization pyramid that we are going to be utilizing when we do each of these items. So you have probably heard over the years, or just when you've been in nursing school, people say, oh, prioritization, just look for airway, or just ABC. And although those general principles can help guide us, it's really not that simple. So once again, here at Bootcamp, we said, we don't want to set you guys up for failure. We wanted to try to provide a little bit more context and a little bit more knowledge than just ABC. So that's what we did with this prioritization pyramid. We used all our knowledge and, of course, those textbooks and tried to come up with a tool to help you navigate prioritization. So how this works is we start with step 1. And when we look at a prioritization item and it's asking us to choose the sickest patient or the patient that needs to be seen first, we can always start with step 1, which is eliminating the stable and the chronic issues. So right away, if we have 4 patients and we see one that is very stable, we can eliminate it. And let me give you an example of that. Say you have a client with a arm fracture, and what kind of symptoms do we anticipate with an arm fracture? If you have a patient that comes in, they fell or tripped, and we anticipate a fracture to their wrist, what are some normal findings that you would expect? And once again, there is a delay, so I know y'all are probably answering me, but I can't see it yet, so I'm just giving y'all a little bit of time. Pain and swelling. Okay, wonderful. So pain and swelling, very, very normal findings, very stable, okay? So when we see a client with a fracture that's got pain and swelling, that shouldn't be concerning to us. Now, if you had a patient that had no pulses distal to the injury, or maybe they had, numbness, those are all really concerning findings that we have decreased perfusion. But if we just see fracture with pain and swelling, that is a stable client, and we can automatically eliminate them because they do not have any type of signs or symptoms that indicate a life-threatening issue. And then we also can eliminate chronic findings. So a great example of a chronic finding is, let's take a patient with, let's say, advanced COPD or end-stage COPD. What would we anticipate in regard to their pulse oximetry level? Okay, so what would a normal pulse oximetry level be for a client with advanced COPD? Somebody said end-stage renal disease, also chronic issue, but let's talk about the symptoms we're getting whenever we're sitting down to look at an item. So 90%, low. Yes. So typically you can anticipate seeing about 88 to 92%. Now, if we took that same patient with a fracture and they had a pulse oximetry reading of 88%, I'm pretty worried, okay? But for a client with advanced COPD, that is normal, that is anticipated, okay? So that's a chronic issue. Once again, I'm not seeing any indication that there is some sort of acute, life-threatening condition going on. I just want to tell y'all are rocking it. Y'all are right on target with these answers so far. So then after we go through step 1 and we've eliminated any stable and chronic issues, we have to look at the rest of the clients that are there, or the rest of our options. And that's when we have to determine who really is the highest priority. Well, usually your highest priority clients are going to be those with airway and safety issues, because those are going to be what kills our patient fastest. And guys, that really is what prioritization is all about, is we have to ask ourselves, what is going to kill our patient fastest, okay? So airway and safety are typically our top priorities. Once again, though, that's as long as it's not a stable or chronic issue, okay? Followed by breathing, circulation, and disability. So just A, B, C, D. So a lot of times disability maybe isn't as commonly known, but disability just means neurological conditions, okay? A lot of times we see it in trauma nursing. It's synonymous. It's the same thing, disability and neurological. So that's going to be a change in mental status, stroke symptoms, that type of thing is disability. And then our lowest priority needs, or lowest priority clients, are going to be up here in green, okay? And that's going to be routine tasks. So maybe your morning AM labs that are ordered every day, any expected findings, and we kind of already talked about that. Our COPDer that has a little bit of a decreased pulse oximetry reading, a fracture with pain and swelling, these are all expected. And then, I might have colored too much. Let me erase just a tiny bit so you can see that. Also in green is going to be psychosocial needs. And when I say psychosocial needs, I'm talking patients that are anxious, maybe they're angry, and certainly we want to use therapeutic communication. We want to address their concerns, but typically anxiety or anger is not going to kill you. So that is typically a lower priority. So this tool is certainly, the more you practice with it, the easier it's going to be to understand it. And it is a wonderful, wonderful resource to navigate these types of prioritization items. So let's put it to work and see what we can do. Okay, so very first item we have here is the most common way you are going to see prioritization items asked or framed. And that is going to be trying to identify the client that requires your attention first, okay? So always look closely at our header and stem and see what is it really asking us. So this item is saying the nurse should first assess which client, okay? So we're looking for who is most ill, most sick. So let's go through our options. Option 1, we have a client who is obtunded on hospice care and is becoming restless. Option 2, we have a client with a cholecystectomy 2 hours ago reporting nausea. Option 3, a client with a peptic ulcer with a rigid abdomen reporting sharp abdominal pain. And option 4, a client who had abdominal surgery 2 days ago and now has left lower extremity pain and swelling. So let's take a look at these just a little bit closer. I know we've already got some people guessing some answers, and I love it. But certainly, let's look a little closer and see why they might be right or wrong, and see if we can tease out a little more learning. So option 1 is a wonderful opportunity for us to remember a very important test-taking strategy. Don't latch on to just a keyword, okay? That's a good way to get yourself in trouble when you're doing any type of items, but especially prioritization. Because if I saw that all of a sudden a client is obtunded and they're becoming restless, they have this change in mental status, that could be very concerning. I might be worried about stroke. I might be worried about hypoxia. But in this case, I have to look at it in the context of what it's telling me, okay? And that is, I have a client on hospice care. And remember, a client on hospice care is going to have a terminal illness. We anticipate that as they get closer to the dying process, their mental status is going to change. They're going to become restless. So for a client on hospice care, is this change in mental status expected? What do you guys think? So I'm going to go with 1 is right here in green with expected finding. So that is a low priority, okay? Option 2, I have a client with a cholecystectomy 2 hours ago reporting nausea. So do we anticipate nausea? Well, let's talk about this. Anytime we send a client to surgery for any reason, anesthesia medications can cause nausea. In addition, this is a client that just had abdominal surgery and they had their gallbladder removed. And we know gallbladder problems alone can cause some nausea. So once again, this is a very expected finding for this client. So we're going to put it right up there with the other one. For the very top of our pyramid, expected finding is going to be option 2. And then option 3, I see you guys love. So let's talk about why y'all might be right. So we have a client with a peptic ulcer with a rigid abdomen. So I want to tell you guys, anytime you see the words rigid abdomen, or you might also see the words board-like abdomen, firm abdomen, all these types of things, hard, it's going to be a big red flag to you that your client potentially has peritonitis. And the reason I went ahead and just told y'all that is I see a lot of y'all are typing it. So y'all are already on the right track. That rigid board-like abdomen is an indicator of peritonitis. Also, whenever they have that board-like abdomen, they typically have some sharp abdominal pain and discomfort. So peritonitis, if left untreated, what do we anticipate will happen? So what is going to happen if we leave peritonitis untreated? So we see this client with a rigid abdomen and we're like, oh, they're okay, and we leave them. What's going to happen to them? Infection, yeah. So that's what we're concerned about. Remember, peritonitis is that peritoneal cavity, okay, in the abdomen, and it gets inflamed. And I see a lot of you guys saying rupture, shock, septic shock, and y'all are 100% right. So that is, if you leave it untreated, you can anticipate that soon you're going to start seeing signs of shock, such as tachycardia, hypotension, pallor. They might become diaphoretic. And this is a life-threatening emergency. So that is certainly going to be a circulatory issue. Option 3 is circulatory. So it's much higher priority on our pyramid here. But let's look at option 4 and make sure that this is in fact the highest priority client. So option 4 is abdominal surgery 2 days prior with left lower extremity pain and swelling. So anytime we have a client that is post-op, chances are they're not as mobile as they usually are. So they're probably laying in bed and now they have unilateral pain and swelling. So what do you guys think is going on with option 4? What do you think this client is experiencing with unilateral pain and swelling post-operatively? We are anticipating a DVT. Very good. So DVT. So DVT is also a circulatory issue on our pyramid. So that's where it could be a little confusing. They're both circulatory issues. But we have to just look at them and put them in context. With our DVT, we are still having just localized pain and swelling. Whereas untreated peritonitis is going to lead to a systemic circulatory issue. So we have circulatory issue in just the leg versus circulatory issue that's affecting perfusion to the entire body. So you guys are 100% correct with option 3. But let's talk about when option 4 could have potentially been correct. Maybe instead, the option could say, we have a client that's post-operative who has left lower extremity pain and swelling, and now they have tachycardia. They're restless, they're anxious, they're short of breath. What do you guys think would be going on then? If we had a client that has a lower extremity pain and swelling, and then now all of a sudden they're having dyspnea, they're having anxiety, what might be going on? Let's see, I'm looking in the comments. PE, very good, guys. And so we know PE is a breathing issue. And so in that case, that would be our highest priority. So someone asked, made a great comment. I just want to point out that they said DVT is expected after surgery. So I want to tell you guys, be really, really careful. When we're saying expected findings, we're meaning something that is normal, that is not a complication. So even though DVT commonly occurs, or I shouldn't say, let's hopefully not commonly occurs, but even though DVT can occur post-operatively, it's not expected because we don't expect a client to develop a DVT. We hope they don't. We certainly do interventions like, SCDs, blood thinners to try to prevent it, but it's not expected when it's a complication, okay? I just don't want you guys to get confused. But y'all seem like you're doing a phenomenal job. So we can see once again, option 3 is correct, and you guys did great. So now let's shift gears just a little bit, and let's go to another way that prioritization questions are formatted. This is another common method of prioritization question formatting, where instead of choosing the client that is the highest priority, we are instead going to try to find the task that is highest priority. So this question says, the nurse has been made aware of the following client situations. Which of the following client needs should receive the highest priority? So which need or task is most important for us to do? Option 1, administer an antibiotic to a client with cellulitis that was due 1 hour ago. Option 2, assess the client who reports redness and pain at their appendectomy incision site. Option 3, assign assistive personnel to stay with a client who is reporting suicidal ideations with a plan. And option 4, provide discharge education to a frustrated client who's been requesting discharge paperwork for 2 hours. So I see you guys are already answering this question, and certainly I love your answer, but I think we can gain a lot more knowledge by looking at our wrong answers here for a second. So option 1, administering an antibiotic to a client with cellulitis that was due 1 hour ago. So that is a routine task over here on our little pyramid. Routine task. That's the messiest one I've ever drawn. Let me keep it pretty for you guys. Let's try again. Simple. Okay, so that is a routine task, antibiotics. And certainly we want to administer medications in a very timely manner. But typically delaying an antibiotic for 1 hour is not going to create any type of life-threatening issue for our client, okay? So that, once again, routine, not going to create any type of life-threatening complication. Option 2, assess the client with redness and pain at their appendectomy incision site. So if you guys are caring for a client who has a surgical incision and now they're experiencing redness and pain, what do you guys think is happening? What are you anticipating? Now, this can be potentially, depending on the level of pain and erythema, it could be a normal finding, just having some inflammation at the site from the surgical trauma. But what else might they be at risk for if they're having redness and pain at a surgical incision site? Infection. Very good job, Tenzin and Angelica. So we are concerned about infection, but right now it seems localized. And this is my second opportunity to give you guys a really good test-taking strategy. Don't read into items. Don't add information. I was a nursing student once, and I know that that's very tempting. So we can go down this little rabbit hole and say, oh, if they have infection, they might develop sepsis. That's a circulatory issue. Don't do it. Don't mess yourself up, okay? Right now, let's just take all the items for face value. Let's not add information. This is localized redness and pain, so it's not appearing to be any type of life-threatening emergency. And then option 3, which is you guys' favorite, and I totally agree, is assigning assistive personnel to stay with the client who's reporting suicidal ideations with the plan. Because anytime a client has suicidal ideations, we should, of course, be concerned. But it really increases the level of acuity when a client has a plan. Many times when they have a plan, they have thought this through, and there is a much higher likelihood that they will make, an attempt on their life. So that is, as you guys have said, a huge safety issue, which is a very, very high priority. And then last option, provide discharge education to a frustrated client who has been requesting discharge paperwork for 2 hours. So that is a frustrated client. I would be frustrated too if I'd been waiting 2 hours. But once again, psychosocial needs aren't really typically going to pose any type of life-threatening emergency or kill us. So I love option 3 is the correct answer, and we got it right. So let's do one more, and let's flip it a little bit backwards, okay? These aren't as common, but you still will see these types of prioritization items, where instead of identifying the highest acuity or the most sick patient, we are instead going to be looking for the client that is the least sick or the lowest acuity. So let's take a look. The nurse is caring for admitted clients involved in a mass casualty incident, and the nurse must discharge a client to make a bed available for another client, okay? So it would be most appropriate for the nurse to recommend discharging which client, okay? So let's look at our options. Option 1, we have a client with a contusion to the chest wall with a heart rate of 110. Option 2, soot around the nose and mouth and a respiratory rate of 30. Option 3, headache and bruising behind the ear following a head injury. And option 4, superficial non-bleeding abrasions to the face and upper extremities. And I know you guys love option 4 already, but one of the reasons I wanted to do this practice question is I've put some very high yield or very emergent conditions in this question I want you guys to be thinking about as you do prioritization items. So option 1, contusion or bruising to the chest wall. And remember, we see up here mass casualty incident, so we can assume all these clients have been involved in some sort of trauma. So if we have bruising to the chest wall and we have a little bit of tachycardia, our heart rate is 110, so it's a little bit elevated. So if we have bruising to the chest wall and tachycardia, is there any clinical condition that just pops in your brain? Anything you're worried about? So me, I was an ER nurse for about 10 years. And anytime I see bruising to the chest wall with tachycardia, there is one condition that just pops in my brain that I'm worried about. It's kind of a hard one though. So bonus points to whomever gets it. Okay, y'all are making a lot of great guesses. You know, flail chest, Chandra, we typically with that, we're going to see, the breathing pattern changes. I see pneumothorax. Okay, y'all are not wrong. Pneumothorax could be the right answer. But also I'm worried about cardiac tamponade. I don't know if y'all remember cardiac tamponade. We don't talk about it quite as much. That's where that pericardial sac around the heart fills with fluid. And so that heart can't pump as effectively because it's got that fluid there. And so you see that cardiac output is going to decrease, and that patient's going to start having changes in their blood pressure. They're going to start becoming tachycardic, all these types of things. So whether it is a pneumothorax or cardiac tamponade, that is breathing and circulation up here. Very high priority needs, okay? So I hope you would not want to send somebody home that has a potential pneumothorax or cardiac tamponade. And then we go into option 2, soot around the nose and mouth and a respiratory rate of 30. So that respiratory rate is a little high, and that soot or that ash around the nose and mouth, it should be a big red flag to you guys. Anytime y'all are doing any type of question and you see that the client has soot on their face, around their nose, maybe they've coughed up sputum and it's ash tinged, that is always a really concerning finding in which I'm worried about an inhalation injury, which somebody said earlier, so kudos to you. And then Angelica, smoke inhalation, yes. So inhalation injuries are especially concerning because seeing that soot in the sputum around the face, we know they have breathed in some smoke and ash, and that is a really big irritant. So once it gets in that airway, a lot of times it causes a lot of inflammation. And this condition is so life-threatening, a lot of times we just go ahead and intubate these patients right away because our concern is if we don't secure an airway, that airway is going to just get more and more inflamed, and before you know it, the client's not going to be able to breathe. So with anytime you see soot around the nose, the mouth, or it's in the sputum, that's a big old concerning airway or breathing issue for you guys. That's an inhalation injury. Okay, so moving on to option 3, headache and bruising behind the ear following a head injury. So anybody want to guess? I know it's kind of a hard one too. But bonus points to the person who can tell me. Anytime you have bruising behind the ear following a head injury, what is that called and what am I concerned about? I'm going to give you all a second to answer it. Very good. Basilar skull fracture. Kudos to you guys. So anytime you have that bruising behind the ear, that's battle sign. Okay? And Dania, I hope I said it right, Dania. Very good. That is an indicator that you have a skull fracture. So with that could be a disability issue or even potentially a circulatory issue. So option 3. So the point is, I would hope as nurses that y'all would not want to discharge home any of the clients we just talked about. Okay, all of those guys require a lot more nursing interventions before we send them home safely. And then option 4, superficial non-bleeding abrasions to the face and upper extremity. I feel pretty comfortable sending them home, okay? Now, if it said they were bleeding profusely or there was any signs of decreased perfusion, such as pallor, decreased pulses, diaphoresis, I'd be worried. But in this case, we look pretty good, okay? But I hope you take away these clinical findings we talked about. That's why I wanted to include this item once again, is all these types of these clinical indicators here are very high yield, very testable conditions. That cardiac tamponade or pneumothorax, the inhalation injury, and the basilar skull fracture, okay? So y'all did a phenomenal job on that. We got it correct. We're rocking it today. So once again, we do have so many prioritization practice questions available on bootcamp.com, and we also have these free cheat sheets. And I know Miss Miriam is going to put that link in the chat if she hasn't already. Those cheat sheets will help you with, every day we're coming out with more and more of them. They are available free, but we do have a wonderful one on prioritization that goes over everything we talked about today and a couple of other helpful tips. So before, I want to give you guys an opportunity to ask any questions. So while y'all are typing y'all's questions, I wanted to briefly just show you guys our website. So if you click on or go to bootcamp.com/NCLEX, you can see right away, as soon as you get there, you can start setting for free. Clicking that purple button, start setting for free. You won't be prompted to enter any payment information, anything like that. And you can automatically access some case studies for free as well as our cheat sheets. So we have been told by so many students who have gone to take NCLEX that our resource is very, very, very close. Many have said they felt like they were just on our website studying when they took NCLEX. So that's the greatest of compliments. You can see here the case studies are very, very well developed, have the client charts, and are just wonderful, wonderful resources. Once again, we also have the cheat sheets available for free there as well. And please follow us on socials. I'm sure Miss Miriam also put those links in. So let's look at some questions you guys have asked. Let's see. BB, if the question was reversed, which one will you pick as a priority? Are you, you're asking me for option 3? That's a very good question. So let's take a look at it. So when we look over here at our pyramid that I doodled all over, you can see that option 2 is the potentially an airway issue. So I would certainly choose option 2 over the other ones, just because, once again, if I don't have adequate oxygenation, that's going to kill me really quickly. So having a potential inhalation injury and requiring potential intubation is certainly going to be my highest priority, okay? Followed by probably the client. If I had to order them, I would say option 2 is probably going to be my first priority, followed by option 1, because they are already demonstrating signs of inadequate cardiac output. I'm starting to get tachycardia, so I'm worried there about circulation. I am such a messy doodler today. Circulation. And then my client in option 3, they have that headache and that bruising, but I'm not yet seeing altered mental status. And I'm not going to read into it. Right now, it just says they have a headache and bruising. So right now they seem a little more stable than my clients that are more symptomatic. I hope that helps. How do you answer best priority versus first priority? I'm not quite sure what you're asking there, Jay. Typically if you're asked what is the best option, I believe it would still it's still asking you to just prioritize like the best option or the first option. If I'm not understanding your question, please, you have a second to clarify a little bit, I'd be happy to help you. Okay. Any other questions, guys? Let's see if I missed any. Thank you guys so much for y'all's participation. It always makes it more fun for me whenever you are participating, and y'all are doing amazing. Y'all should feel very proud of yourselves today. I have my NCLEX. Okay. Agnes, you said like what to do initially. I don't know, guys. Y'all feel free to expand just a little bit. Oh, okay. So this is a good question. In mass casualty, you pick red tag before black tag. Typically, yes. And we do have some practice questions on disaster triage in our question bank, because many times if you have a client and you're dealing with a trauma and there's, many different patients you're having to sort through, a client that we know can't be saved, the black tag client where they're pretty much, maybe they're pulseless, maybe they're apneic. If we can't use the resources on a client that has a very low likelihood of being resuscitated, if we can save others. So yes, very good question. Okay. Any other questions, guys? Thank you all so much for joining us today. We do have weekly webinars, so please join us for the next couple weeks. I know we're going to do another management of care topic in 2 weeks on delegation. I know that's also a topic a lot of people struggle with. Okay, guys. So I think that is about it. I hope you guys have a wonderful rest of your day. And thank you so much for joining us. And we look forward to seeing you next week. Have a great day.